Good morning to my respected teacher and all my dear friends. Myself Lakshyarth kumbhaj, and I am explaining inflammatory disease of female genital organs. The inflammatory process of the female genital organ constitute approximately 65% of all gynecological disorders. Etiologies and way of spreading. The inflammation disease of the female genital organs can be caused by following factor. First, infection, mechanical and thermal. Two type of etiologies, non-specific and specific. Non-specific is the inflammation caused by the some staphylococcus, E. coli, streptococci, pseudomonas, and the specific and the inflammation caused by trichomonas, gonococci, fungi of genus Candida, and mycoplasma viruses, and chlamydia and mycobacterium tuberculosis. There are some physiological barrier to spreading of inflammatory disease in women. Vulva, vagina, mucus plug of the cervix, and the severe narrowing of the cervical canal, the site of the internal os and the isthmus. Cyclic delamination of the function layer of the endometrium during menstruation, and the peristaltic contraction of the fallopian tube, flicker epithelium, presence of the multiple mucosal folds and epithelium and connective tissue sheet inside the ovaries. Now, the inflammation of lower genital organs. Vulvitis, the inflammation of the vulva, and Bartholinitis, inflammation of the large vestibule glands, and vaginitis, and inflammation of the cervix. Cervicitis, the inflammation of the mucous membrane, the cervix covered by the stratified squamous epithelium. I am telling about cervicitis, and the enterocervicitis, the inflammation of the mucous membrane which passes into the cervical canal covered within columnar epithelium. Now, inflammation of upper genital organs, pelvic we can say, the body of the uterus, endometritis, inflammation of the mucous membrane, and the metrometritis, the inflammation of the mucous membrane and muscles, and the appendages. I am explaining some diseases like lower and upper, and I will also explain the diagnosis method and treatment. And firstly, I am explaining with the lower genital organs diseases. Firstly, vulvitis, the inflammation of the vulva. The woman of reproductive age often is secondary, like colpitis and cervicitis, endometritis. And the primary vulvitis diagnosed with the diabetes, skin diseases, thermal, mechanical, chemical skin lesion of the external genitalia, ovarian hypofunction, and the distinguish between acute and chronic vulvitis. Acute vulvitis. The patient complain of burning and itching of vulva, especially after urination, and purulent discharge and pain during movements. Acute process is accompanied by tissue edema and diffuse hyperemia of the inguinal fold area, inner thigh, and sometimes increasing the inguinal lymph node, and often combined with genital warts and located in the parental cleft and anus. Chronic vulvitis, as manifested by itching, burning, and erythema, but these symptoms are the smooth characters, and I am showing some pictures. Now, some diagnostic methods is based on the data history like somatic diseases, failure to observe sexual health and traumatic injuries, and evaluation of the patient complaints, and gynecological examination results, and microscopic data, and bacteriological study of the vulva secretions. In the treatment of the vulvitis, complex involves the use of local and bracing, means therapy shows comorbidities must comply with bed rest and refrain from the sexual of external sexual organs, like use potassium permanganate warm solution, was is to ratio 10,000, and the warm chamomile extract and 2 to 3% solution of boric acid and furaculinum solution was to ratio 5000. For the severe itching, apply 5% of anesthetizing ointments. Endocervicitis, the inflammation of mucus of cervical canal, lead to the occurrence as a result of the birth trauma and abortion and intervention as well as disease of other part of the reproductive systems. Main complaint of the patient are the mucopurulent, white and nagging pain in the lower abdomen and lumbus. When viewed in the speculum, redness around the external OS and mucopurulent discharge from the cervical canal. Now, the diagnosis of endocervicitis is based on from the clinical presentation and the speculum examination, and we will do colonoscopy, bacteriological examination of the secretions, and the cytology defined the cylindrical cells are stratified squamous epithelium without sign of the atypia. The treatment of the endocervicitis in the acute stage use antibiotic therapy based on the pathogen, and the local procedures are contraindicated. They perform only after remission process. Irrigation vaginal bath with the chlorhexidine and racutenum and dimaxidum. I am now some risk factor of inflammation of female genital organs. Early sexual activities, multiple sexual partners, use intrauterine contraceptive devices, and the presence of inflammatory disease of the pelvic organ in the history, and the history of the patient or her partner of inflammatory disease of the lower genital disease or sexually transmitted disease. I am explaining now inflammation of the upper genital organs. Like endometritis, the inflammation of the mucous membrane of the uterus and usually occurring after intrauterine interventions. Diagnostic criteria: abortion, complication, childbirth, and IUDs. The inflammation can spread to entire membrane of the uterus or have a focal character. In the severe endometritis, a muscular layer involved in the process.